So it's finishing the specialties and specialists of the eye. So ophthalmology is the medical specialty concerned with the study of the eye, its diseases and refractive errors. An ophthalmologist is a physician who specializes in ophthalmology. Common abbreviations you're going to see related to the eye is EOM, extraocular movement, IOL, intraocular lens, IOP or intraocular pressure, LASIK, laser assisted in situ keratomileusis, and OD, right eye, oculus dexter, OS, left eye, oculus sinister, OU, each eye or both eyes, oculus utercu, PRK, photorefractive keratectomy, VA, visual acuity, VF, visual field. So we'll move to the functions of the ears are to provide hearing by translating sound waves to nerve impulses that are carried to the brain, to assist the body in maintaining equilibrium or balance. The ear consists of three parts: the outer ear, the middle ear, and the inner ear. The outer ear, the pinna, is the external auditory meatus and tympanic membrane. The middle ear is the pharyngotympanic tube and the auditory ossicles, the malleus, the incus, and the stapes. The inner ear, also known as the labyrinth, is the cochlea, the semicircular canals, and the vestibule. Here you can see the structures of the outer, middle, and inner ears. The auricle on the outer ear, the tympanic membrane or the eardrum, and the external auditory meatus. The ossicles of the middle ear include the stapes, incus, and malleus. The inner ear, you can see the semicircular canals and the cochlea, as well as the vestibule, and then the pharyngotympanic tube or the auditory tube. Structures of the outer ear, the auricle and the pinna is the external portion of the ear, as we just saw. The external auditory meatus or the external auditory canal is the canal that extends from the auricle to the tympanic membrane. Cerumen is the waxy substance created by glands of the external auditory meatus or the earwax. TM for the tympanic membrane or the eardrum, that's the semi-transparent membrane that vibrates to transmit sound waves to the ossicles, and it separates the external auditory meatus from the middle ear cavity. The mastoid bone and cells are the bones located behind, or the bone located behind the ear that is filled with air cavities and encloses the middle ear. The pharyngotympanic tube or the eustachian tube or the auditory tube is the tubular channel that runs from the middle ear cavity to the pharynx. The auditory ossicles include the middle ear bones contained in the tympanic cavity that transmit sound vibrations. So the malleus, that's the auditory ossicle shaped like a hammer or a club. The incus is the auditory ossicle shaped like an anvil, and the stapes is the auditory ossicle shaped like a stirrup. So here is the ossicles of the middle ear: the incus, the malleus, and the stapes. Additional structures of the inner ear are the labyrinth or the inner ear, and that's made up of a series of semicircular canals, the vestibule, and the cochlea. The cochlea is the snail-shaped organ that contains the organ of hearing, and the spiral organ or the organ of Corti is the receptor for hearing located within the cochlea or the organ of hearing. The vestibule is the anatomic chamber, such as that found in the inner ear. The semicircular canals and ducts are the small tubes in the labyrinth that contain receptors, and those assist the body in maintaining balance. So let's talk about the combining form. Acoso, or hearing sound audio, for hearing, ari, ario, odo for ear, cochleo for cochlea, Labyrintho for labyrinth or inner ear, mastoido for the mastoid bone, meningo or tympano for the tympanic membrane in the eardrum, sclera for hard or sclera, stapedo for stapes, vestibulo for vestibulal, and prefixes dis for painful, difficult, abnormal, suffixes acousis for hearing, algia for pain, ectomy for excision or surgical removal, and stomy for surgical opening. Some adjectives and other related terms include acoustic, which is pertaining to hearing or sound, auditory, pertaining to hearing, oral or otic for pertaining to the ear, cochlear for pertaining to the cochlea, labyrinthine for pertaining to the labyrinth or inner ear, mastoid for pertaining to the mastoid bones and cells, tympanic for pertaining to the tympanic membrane or tympanic cavity, vestibular for pertaining to a vestibule. The acoustic neuroma, these are common symptoms in medical conditions. An acoustic neuroma is a benign tumor that develops on the acoustic nerve and can cause hearing loss. The cerumen impaction is the excessive buildup of earwax. Cholecystectomy is a cyst-like tumor of skin in the middle ear. It's behind the tympanic membrane, and it usually caused by chronic otitis media. Conductive hearing loss is hearing loss due to obstruction or lesion in the outer or middle ear. Dyscausia is the impairment of hearing involving difficulty in the processing of sound. Labyrinthitis, as you can imagine, is the inflammation of the inner ear. Mastoiditis is the inflammation of the mastoid bone. Meniere's disease or Meniere syndrome is the chronic condition of the inner ear, and it's characterized by dizziness, tinnitus, hearing loss, and a sensation of pressure in the ear. Meningitis is an inflammation of the tympanic membrane. Otalgia is pain in the ear. OE stands for otitis externa, and that's the swimmer's ear or inflammation of the external auditory meatus. OM is otitis media, and that's inflammation of the middle ear. Here we can see the red in the otitis media, indicating its inflammation. Otomycosis is the fungal infection in the ear. Otopyuria is a discharge of pus from the ear. Ortorrhea is any discharge from the ear. Otosclerosis is a hardening of the ossicles, particularly the stapes. And presbycusis is the impaired hearing caused by old age. Sensorineural hearing loss is hearing loss caused by the damage to the inner ear or the auditory nerve. Tinnitus is noises in the ear, such as a ringing or a buzzing or a humming. The tympanic membrane perforation is a hole or a rupture in the eardrum. And vertigo is that sensation of spinning, and it's commonly used to mean dizziness. Common procedures and tests for the ear are an audiogram, that's the record of hearing, and it's presented in a graph form. An audiometer, that's an instrument for measuring hearing. Audiometry is the measurement of hearing. A decibel, or lower D and uppercase B, is the unit for expressing the intensity of sound. Electronystechomography, ENG, is a recording of eye movements in response to electrical impulses to diagnose balance problems. A hertz, HZ, capital H, lowercase z, is the unit of measure of frequency or pitch of a sound. An otoscope is that instrument we use for examining the ear. Otoscopy is the use of an otoscope to examine the external auditory canal and tympanic membrane. Tympanochlear gram is the record of a middle ear function, and that's when it's represented in a graphical form. Tympanometry is the measurement of middle ear function. Here you can see someone using an otoscope to perform otoscopy. An ophthalmoscope is a common use of an instrument used for examining the interior of the eye through the pupil. Pupillometry is a measurement of the pupil. Ophthalmoscope is the use of ophthalmoscopy is the use of the ophthalmoscope to view the interior of the eye, and these particular ones have to do with the eye. Refraction is the test using a manual refractor determining the exact vision prescription. Common surgeries and procedures, cochleal implant, that's an electronic device implanted in the cochlea, and it stimulates the auditory nerve, and it provides hearing sensations for the profoundly deaf. An ear lavage is when you irrigate the ear to remove the earwax or cerumen buildup. A labyrinthectomy is an excision of part of the labyrinth. Mastoidectomy is the excision of part of the mastoid bone. A mastoidotomy is an incision into the mastoid bone. Myringotomy or tympanostomy is the surgical incision or opening into the tympanic membrane to drain fluid from the middle. Otoplasty is the surgical repair of the external ear. Stapedectomy is the removal of the stapes and the replacement with a prosthesis, and this is done to correct hearing loss from otosclerosis. Tympanoplasty is the surgical repair of the tympanic membrane or middle ear. Tympanostomy tube placement is the placement of the tube in the tympanic membrane to relieve symptoms caused by fluid buildup. We commonly call those ear tubes. Here's the tympanic membrane with a tympanostomy tube in place. Medications and drug therapies associated with the ear, antibiotics used to treat otitis media and other ear diseases caused by bacteria. Cerominolytic is a substance instilled into the external auditory canal to soften earwax. And otic is any medication that can be instilled into the ear drop by drop. Specialists and specialties in this area are audiology, and that's the specialty concerned with the study and treatment of hearing disorders and fitting of hearing aids. Audiologist is a person who specializes in audiology. Otology is the medical specialty concerned with the study of ears and treatments of ear disease. And an otologist is the physician who specializes in otology. An otorhinolaryngology is a medical specialty concerned with diseases of the ear, nose, and throat. And an otorhinolaryngologist is the physician who specializes in otorhinolaryngology. Abbreviations: AD, right ear, oris dexter; AS, left ear, oris sinister; AU, each ear or both ears, oris utrac; DB, decibel; EENT, eyes, ear, left, and throat; ENG, electronystagmography. Electronystagmography. So ENT, ear, nose, and throat; HC, Hertz; OE, otitis externa; OM, otitis media; TM, tympanic membrane. So go ahead and practice your words, and good luck on the test.